had discussed about hypersensitivity type 1 and type 2. Today I am talking about type 3 and type 4. First, I will take up type 3 hypersensitivity. Type 3 hypersensitivity is also called as preciptin allergy. It is because of the complex formed by the soluble antigen with antibody results in formation of precipitate. The soluble antigen could be of bacterial origin, or viral origin, or plant or animal origin. When this soluble antigen is in large amount and the antibody is also in large amount, when they form the complex, they result in formation of large amount of precipitate in the body. And this precipitate formation will result in adverse reaction. And this precipitate may get deposited in different parts of the body, resulting in different complications. Now we will see what are the different types of complications that take place with type 3 hypersensitivity. The antigens could be of protein vaccine origin, and these protein vaccines may be of bacterial or viral vaccines. And it could be also even the antivenom produced in other animals. Especially the antivenom is produced in horse. The antivenom against the snake venom is produced in horse, and large amount of antivenom need to be administered to a snake bite victim, because to neutralize the poison that has entered the body, the large amount of antivenom is required. So when this large amount of antivenom of foreign origin, that is animal origin, is introduced into the human host considers this antivenom as a foreign protein and mounts an immune response against it. But in the first instance, there will be no much reaction, but because of the formation of complex with the poison of the horse venom, it could result in adverse effects. The type 3 hypersensitivity is classified into two types: Arthur's reaction, which is demonstrated on the skin surface, and serum sickness. So what is this Arthur's reaction? Arthur's reaction is nothing but formation of ulcerative crater on the skin surface when the antigen enters through the skin, when there is good amount of antibody in the host. So the antibody that is present in the host in large quantity immediately recognizes the antigen that enters the cutaneous surface and mounts an immune response there and forms a complex with the antigen as soon as it enters the body, and forms a precipitate locally in the cutaneous area. And that formation of precipitate there would result later due to severe inflammatory reaction, which I'll be discussing little later. You will see that the inflammatory cytokines and inflammatory cells will infiltrate that area where the precipitate has been formed, and even the complement is going to be activated, and due to activation of the complement causes the lysis in the area, causing a ulceration. So the Arthur's reaction can be classified into reverse Arthur's reaction and passive Arthur's reaction. The reverse Arthur's reaction involves intravenous injection of an antigen, that is a protein, and then to the same animal intracutaneous injection of the corresponding antibody. When the antigen and antibody interaction takes place in the cutaneous area where the injection was done, within a few days' time, due to inflammatory reaction, that area develops ulceration. Passive Arthur's reaction is slightly different, where the intravenous injection of protein antigen is done, and then the intracutaneous injection of a serum from the animal that was sensitized against the same antigen is introduced intracutaneously. Now, this animal would have produced the antibodies against that antigen, and the serum contains the antibodies. And on injection of the serum of that animal into the another animal which was given the same antigen through intracutaneous route, at the site of injection there will be formation of ulcer. This is Arthur's reaction. Initially, the Arthur's reaction will be seen as a red patch like this on the skin surface, and that red patch is nothing but erythema, where the antigen entry has taken place and immediately the antibody has reacted, and there is a kind of hemorrhage in that area because of the complement mediated lysis in the local area, and that finally transforms itself into an ulcer if not taken care of by control measures. So the serum sickness is nothing but when large quantity of the proteins of animal origin, especially the antivenom, is administered, the serum sickness will be experienced by the person, and that I will discuss little later. Let us see the reaction mechanism of type 3 hypersensitivity. In this diagram, it is depicted the antigen is injected through the skin surface. As soon as the antigen makes its entry into the cutaneous area, into the deep cutaneous area, if the antibodies are already present against that antigen, the antibodies will form the complex with that antigen in that area and deposit that as a precipitate. And that antigen antibody complex which is formed in that area will initiate complement reaction. As soon as the complement reaction is initiated, the complements will form certain derivatives of its own, and those derivatives are C3A, C4A and C5A, which are the complement components, which are the byproducts of the complement activation. And when I had explained about complement activation, I had said that all these three complement components, C3A, C4A and C5A, are considered to be anaphylotoxic. In the sense, all these three have a receptor on the surface of the mast cells. In the immediate vicinity, wherever the blood vessel is, the mast cells will be present, and the C3A, C4A and C5A released due to activation of the complement by the antigen antibody complex will react on the mast cells. By reacting on the mast cells, the mast cells get activated and they release the cytokines, which are the primary mediators of the mast cells. And these primary mediators include histamine, prostaglandin, okay, and 5-hydroxytryptamine. So even including neutrophil chemotactic factor. So the mast cells activated will have adverse effect on the blood vessel. Blood vessels get dilated. At the same time, the diapedesis of the neutrophils starts. Diapedesis is extravasation of the neutrophils from the blood vessels to the tissue space where the antigen antibodies complex is formed. So neutrophil chemotactic factor released by the mast cells initiates large number of neutrophils to infiltrate that area. At the same time, C3A and C5A and C5b67 complement component formed will activate the neutrophils and it act as chemotactic factor for the neutrophils. With the result, larger number of neutrophils will infiltrate that area where the antigen antibody complex is formed. So the complement mediated reaction is already initiated and that will be taking place. At the same time, the complement formed or initiating neutrophil activation and mast cell activation, and the neutrophils have come to the site and they get activated by binding with C3a complement. And the C3a C3b complement will result in neutrophils to release large number of lytic enzymes. And the lytic enzymes released in the vicinity in that area will be responsible for dissolution of the precipitin complex that is formed in that area. At the same time, there will be bystander lysis. The bystander lysis, that is lysis of the neighboring cells, will result in the formation of erythema like this, as seen in the Arthur's reaction shown here. So there is tremendous amount of reddening in that area, erythema, edema and swelling, as well as sometimes even the wells formation or wheel and flare reaction taking place. So the antigen antibody complex, which is in the form of a precipitate, will also now initiate ADCC response in that area, because the FC receptor of the neutrophils, FC receptor of the macrophages will be bound by the antibody FC receptor, and they will be infiltrating that area and causing the inflammation of that area, because macrophages are also capable of producing TNF alpha. When the macrophages get activated due to the binding of antigen antibody complex to their FC receptor, large amount of TNF alpha will be secreted in that area. And TNF alpha is an inflammatory cytokine. So the reaction that builds up in that area will result in causing lot of tissue damage. And this is the picture that I am showing only on the skin area, skin surface, due to the entry of the antigen. And imagine in a person, if large amount of antigen in the form of vaccine is given through intravenous route, and that vaccine gets distributed in the body in different regions of the body as a protein, which is an antigen. And as soon as that vaccine enters to different parts of the body, if the person was already sensitized against that vaccine, and it is a booster dose which was given, and it is a large quantity of booster dose by mistake, and that antibody which was already produced in the person would react with the large quantity of antigen that has entered in different parts of the body and causing it to be deposited as protein, as antigen antibody complex, as shown here in different regions. Imagine if these antigen antibody complexes in the form of precipitin protein deposits in the kidney. It will damage the basement membrane of the kidney as well as the glomerulus, resulting in glomerulonephritis. If the precipitate gets deposited in the joints of the person, and it would cause the damage to the joints because of the inflammatory reaction initiated in the joint area, as I explained here in the skin area. Same type of inflammatory reaction could be initiated in the joints where the precipitin complex gets deposited. It would result in rheumatoid arthritis like symptoms. Severe pain in the joint would occur. So therefore, type 3 hypersensitivity, in other words, is a reaction which is a complex of a soluble antigen with a protein forming a precipitate, and that protein complex forming a precipitate with the antibody will get deposited in the organs, causing damage to the organs. So therefore, the controlled measure of injection of vaccine is very essential, by knowing that if the person was already sensitized against that vaccine. Similarly, antivenom administration also should be done carefully, otherwise the person would have severe effect of deposition of precipitate of the antigen antibody because of the reaction of the antivenom with the venom which has been circulating in the body, and that would cause severe damage in different parts of the body. Now coming to the serum sickness. The serum sickness is experienced by the person who undergoes antivenom therapy, and it is experienced by the person after 8 to 12 days after the injection of the antivenom. Here, the antigen antibody complex circulates in the body and gets deposited in different parts of the body. This is for a person who has taken the injection for the second time, antivenom second time. And the precipitate that circulates and deposits in different parts of the body causes swelling of lymph nodes, swelling of joints, severe pain in the joints, uh, to some extent fever is experienced by the person, as well as excessive sweating. Eyelids may swell, edema of the face may take place, there will be itching on the body, and even urticarial erythematosus. Urticarial erythematosus means red patches with wheal and flare reaction would be shown on the skin surface. So the person suffering from serum sickness may also have damaged the kidney because of the deposition of the precipitate in the kidney, resulting in glomerulonephritis. At the same time, the severe pain in the joints that is experienced by the person is because of the rheumatoid arthritis like symptom experienced by the person because of the deposition of the precipitate in the joints and causing the inflammatory reaction in the joints. So here is a pictorial presentation of serum sickness which is shown as the initial symptoms, where you can see red patches developed and swollen ankle of the person, and if it is not taken control of, it would spread to the different parts of the body, and you can call this red patches and swelling as urticarial erythematosus as indicated in this slide. And this will continue as long as the antigen antibody reaction continues in the body, and it will be damaging the cells because of the complement mediated lysis and neutrophil mediated lysis and inflammation caused by the macrophages which release TNF alpha in large quantities in that area. So it is, in fact, it may lead to even systemic lupus erythematosus, which is also a kind of autoimmune disorder, systemic lupus erythematosus. The bacterial, viral antigens which enter the body in large amount in the form of vaccine could result in this symptom. And rheumatoid arthritis is also a kind of autoimmune disorder. And glomerulonephritis is also a kind of autoimmune disorder. And all these are because of the precipitin deposition in different regions of the body, causing damage, localized damage. Now coming to the type 4 hypersensitivity, which is also called as delayed type hypersensitivity. Why it is called as delayed type hypersensitivity? The other hypersensitivities may occur within 8 hours, like type 1, type 2 and type 3 hypersensitivity, as well as the type 5 hypersensitivity. Whereas the type 4 hypersensitivity occurs 72 hours after the contact with the antigen. 72 hours is a time of lapse that is given for the delayed type hypersensitivity reaction on contact with the antigen, and that is used as a demonstration as Mantoux reaction against the tuberculin antigen, which I will be explaining little later. The delayed type hypersensitivity takes place in the first place by first when the antigen enters the body through any route, even if it is entering the body through the skin due to puncture of the skin by the epidermal hair of a caterpillar, or it could be a plant derived epidermal hair or a thorn of a plant origin which has stored alkaloid. So as soon as the antigen enters the skin surface deep within the cutaneous area, the antigen presenting cells like macrophages and Langerhans cells will process the antigen, and the processed antigen will be presented to Th1 cells on the class 2 MHC. The antigen presenting cells will process the antigen and present it on class 2 MHC. When the antigens are presented on class 2 MHC, Th1 cells get sensitized, they get activated, and the whole sequence of event can be shown in this manner. Here in the picture, the antigen presenting cell has processed the antigen and presented that antigen on class 2 MHC, and Th1 cell, CD4 Th1 cell is receiving the antigen through TCR. As explained earlier, the B7 and CD28 as well as CD4 have established the contact and a synapse is formed, and Th1 cell is activated. The activated Th1 cell will start secreting IL-2 in large amount, which is an autocrine factor, which results in proliferation of the Th1 cells which are sensitized against the antigen that had entered the body, as well as it will make these Th cells to come in contact with further antigens more and more which are present in the vicinity. And activated Th1 cell will also secrete other cytokines like interferon gamma and TGF beta. Both these cytokines are inflammatory cytokines. So initial phase of activation of the Th1 cell by the antigen is called as sensitization phase. And this sensitization phase may take place up to a week's time. And once the sensitization phase is over, if the antigen is in abundance or antigen makes its entry once again, then it will lead to effector phase. The delayed type hypersensitivity reaction is also shown against the intracellular pathogens. The intracellular pathogens such as Mycobacterium tuberculosis, Mycobacterium leprae, Listeria monocytogenes, and Brucella abortosis, which are bacteria. The viruses like herpes simplex virus, variola virus, and measles virus are known to cause delayed type hypersensitivity. There are intracellular fungi which cause this type of reaction, that is Pneumocystis carinii, Candida albicans, and Histoplasma capsulatum and Cryptococcus neoformis. Even the intracellular parasite Leishmania, which causes the Kala Azar, the black fever. The Leishmania is a protozoan parasite which lives within the cells and causes the fever, and the fever is called as black fever and Leishmania fever, and this parasite also is known to cause DTH response. There are also other antigenic agents which are chemicals or alkaloids of plant origin, such as picryl chloride, hair dyes, nickel salts, poison ivy, and poison oak. and these substances will cause DTH response, delayed type hypersensitivity. As I had mentioned that these pathogens or the antigens of plant or chemical origin would sensitize the individual and activate the Th cells. And once the Th1 cells are activated, they will be in large numbers sensitized against the antigen circulating in the body. And when the second entry of the antigen takes place, or if the antigen is in abundance, the effector response begins. The effector response of the Th cell will be more adverse in the sense it will start secreting other cytokines. It is not only secreting interferon gamma and TNF beta, it will start secreting GM-CSF, granulocyte monocyte chemotactic factor or colony stimulating factor. And this results in infiltration of macrophages into the area where the antigen is in abundance. Large number of macrophages start infiltrating that area and they are getting activated because of the Th1 cell cytokines. The Th1 cell cytokines such as macrophage migration inhibitory factor, macrophage aggregation factor will make these macrophages to assemble in the area where the antigen is in abundance. Macrophages also start secreting the production of TNF alpha because they are also inflammatory in response. They express excess of class 2 MHC as shown in the diagram to process the antigen and present it to the more number of Th cells. They also express TNF alpha receptor on their surface. Their respiratory burst activity increases and they start accumulating in that area where an intracellular pathogen is present in that area, which is releasing the antigens, or the antigen of foreign origin of plant or chemical origin has entered the body and has deposited in the body in that area. There the macrophages will aggregate in large numbers. And the aggregation of macrophages as well as Th cells in that area results in the formation of granuloma, or it is also called as granulomata. Granulomata. The granuloma or granulomata is the characteristic of DTH response where the intracellular pathogens which are in large numbers in a particular area have been now surrounded by the antigen presenting cells, that is macrophages here, which are shown in yellow, and Th cells which are shown in almost colorless. So such a large aggregation of population of cells in an area, Th cells as well as macrophages, to confine the infection to only one area and not to allow the infection to spread to the other area where the intracellular parasite has been now surrounded, is called as granulomata formation. This type of granulomata formation would be seen in a person suffering from tuberculosis. If a person is suffering from lung tuberculosis, in the lung, large number of patches will be seen, and these patches are nothing but granulomata formed by the macrophages which have surrounded the epithelial cells of the lung where the tuberculosis bacteria is residing, and the macrophages are also accompanied by Th1 cells in that area. And such large patches which are deposited in the lung area could be visualized in an X-ray as a dense patch of cells. And by identifying this dense patch of cells, doctor concludes that there is a lung infection. And then by testing for the tuberculin antigen, one can find out whether the person is really suffering from tuberculosis. Similarly, the tuberculosis can occur in other areas of the body also. Bone tuberculosis is there, intestinal tuberculosis there, and liver tuberculosis is also there, where one would see the aggregation of macrophages in the site where Mycobacterium tuberculosis infection has taken place, and they surround that area to confine that infection to that area. So it is DTH response in other sense is a way of confining the infection to one area and preventing the infection from spreading to the other area. It is one way somewhat advantageous. Here is the other example where the response against the poison oak is shown, where it is making its entry through the skin, through the sharp thorn of the poison oak. The alkaloid enters the skin, and that alkaloid is processed by the macrophage in the first entry, and as soon as the alkaloid is processed by the macrophage, it is presenting that to the TH cells, and TH cells are getting activated by the antigen which is presented on class 2 MHC, and further response is same as I had explained earlier, where the aggregation of macrophages will start because of the macrophage chemotactic factor and macrophage migration inhibition factor that is secreted by the TH cells makes the macrophage to accumulate in that area. And this is how a patch will be seen when a poison of the plant origin, that is poison ivy or poison oak, enters the skin surface, and it causes a erythema in that area because of the inflammation caused by the aggregation of macrophages in that area. Compared to the Arthur's reaction, this is milder. It doesn't result in ulceration, but the patch that develops there, erythematosus patch develops there, will be highly itchy. It will be itchy because of the inflammatory cytokines released in that area due to the reaction of the antigen as well as the macrophage infiltration in that area. The other observation that is shown is against the Mycobacterium tuberculosis, which is a test that is performed called as Mantoux reaction. Please note the spelling. It is M-A-N-T-O-U-X, Mantoux, which is named after the scientist, French scientist who found the reaction, sensitization reaction. It is generally used for testing the sensitivity of the person and to know whether the person is immunized against the tuberculosis bacteria. If the person is immunized by BCG vaccination against tuberculosis bacteria, he would have active antibodies in his circulation. Even though the antibodies will not be in large amounts, they will be in small amount, they will be there in circulation, protecting him from the Mycobacterium infection. And to know whether the person is reacting against the Mycobacterium tuberculosis, small amount of tuberculin antigen is injected into the skin, and the reaction could be demonstrated like this. The small amount of tuberculin antigen injected into the skin area, and that area will be marked. And after 48 to 72 hours, when you observe, if the skin develops a red patch like this, it is called Mantoux reaction, indicating that the person is having active immunity against Mycobacterium tuberculosis. The antigen that entered the body through the skin surface has been reacted upon by the antibody, and the sensitized TH cells and macrophages are already there in that area, and the red patch indicates the person is immune to Mycobacterium tuberculosis. If the Mantoux reaction does not take place, it is an indication that the person was not immunized against the tuberculosis bacteria. Therefore, it is highly essential that to test against the tuberculosis by using Mantoux reaction, by using tuberculin antigen and injecting that intradermally and waiting for 48 to 72 hours to see whether delayed type hypersensitivity reaction takes place, DTH response. Since this reaction also shows 48 to 72 hours later, it is called as DTH response. So this is as far as type 3 and type 4 hypersensitivity is concerned.